couple housekeeping items. We just want to note that the sound system in the room that we're doing the LTS is very sensitive, so it will pick up any side conversations that you have. So we just ask that if you do need to have a side conversation, to please either mute your sound or just step out into the hallway or do whatever you need to do just so that that conversation is not picked up on the session today. All right, and just to reiterate, we do need you to type your name, job title, and email address into the chat box now to indicate that you have attended this webinar. So please take a moment to do that now if you have not done so already. And again, if you have not received the materials, please indicate in the chat box that you need those materials. The materials that you should have received were a link to a Google Doc that is titled Overview of Process for Ensuring Fidelity to SBIRT Model in Fiscal Year 1920. You should have received a copy of the PowerPoint slides that we have up on the screen, as well as the SBIRT Proficiency Checklist and a document with a breakdown of the components of the SBIRT Proficiency Checklist. So again, if you need any of those, please indicate that in the chat box now. At the end of this session, you will be provided with a link to complete a survey that is required. We'll remind you again at the end. We just want to kind of put that on your radar before we get started. All right, I'm going to hand it over to Christina Green.
Hi everyone, this is Christina Green. I am the SBIRT Project Coordinator at the Colorado Department of Public Health and Environment, and I want to thank you first off for joining us today. I just want to start off with just giving you an explanation of sort of how we focused our project from year to year. Some of you might recall when you started in the spring of 2018, we did a needs assessment and we also did some initial SBIRT training. And then last year we did, our focus was just to get you guys started with implementing SBIRT, using the tools, using the craft, using the BIRT app. We just wanted you to get used to those data collection tools and just kind of get used to the process. Some of you met with Maureen and she did some QI work with you and did some site mapping of their clinic workflow. And then this year, what I wanted to share with you is our focus is to continue that work, continue doing SBIRT implementation, reporting data, but we're adding a new component, and we need your help with ensuring fidelity to the SBIRT model.
Yes, we could.
So our aim, again, last year was just to provide support and training and tools and have you look at your workflow. But this year, what we're going to do is have you focus on fidelity. So that's what this learning community session is all about today. We're going to explain to you the activities that will be related to ensuring fidelity. So I'm going to then, I think the next slide is going to go maybe to Maureen, and she's going to take it from here. But if you have questions about the fidelity process in the next year, please reach out to me.
Great. Thanks, Christina. This is Maureen Daly. I'm the Clinical Quality Improvement Consultant for the School-Based Health Center Program and the SBIRT Project. And so let's talk fidelity. What is it and why is it so important? Fidelity is the degree to which a program, in this case our SBIRT project, is implemented the way it was intended to be, with all the essential components that make SBIRT effective. And it's important because program outcomes are influenced by the way a program is implemented. So implementing SBIRT with fidelity increases the likelihood of achieving the desired results, which are to basically help teens avoid and or reduce their substance use. So fidelity can be measured in multiple ways using validated tools. And again, it's important to monitor fidelity because it not only can improve the effectiveness of the intervention, but it also can improve efficiency. Effective SBIRT includes you accurately assessing a teen's alcohol and drug use, engaging the teen in short motivational conversation to explore their use, and then to eventually help them resolve their ambivalence to change behavior and to negotiate next steps. So on the right of this slide, you see the SBIRT Proficiency Checklist Self-Assessment of Clinical Applications. And as Mandy mentioned, you should all have a copy of this. And it would be good to open it now so you can follow along because we're going to be talking about this checklist. So this checklist has been demonstrated to be a valid tool. It was validated with preceptors supervising medical residents that were actually doing SBIRT with adults. And so we have a real opportunity to contribute to the body of knowledge in adolescent SBIRT because we are the first, we think, to use this checklist for adolescent SBIRT. And we are in touch with the developers of the checklist, and they're very interested and excited to hear how it goes. So thank you all for participating in this checklist or using this checklist. So I'm going to get into more detail in a second, but basically we are going to ask all providers, practitioners in the school-based health center that are doing SBIRT, so screening, looking at the screening results with the patients and providing counseling, to do the checklist, and we'll talk more about that. Now, I'm suspecting right now you're getting a little anxious about this, and please don't. It perhaps helps to think about this as you would about getting certified or recertified in CPR. It's all about learning the correct skills, remembering all the steps so that you're saving lives. And in this case, you're helping adolescents with substance use. So think about it that way. And a couple of things about this SBIRT Proficiency Checklist. First, it's primarily designed to assess skills, not knowledge. And it assumes that you all have had some prior training in SBIRT and practice of SBIRT. And it assesses the core components of SBIRT and adherence to motivational interviewing techniques. And it's intended for immediate feedback from either someone observing you, role-playing or doing a visit, or through self-assessment that you do yourself after you interact with the student. So again, hopefully you're all looking at the checklist now, and you can see it has 4 sections: screening, brief intervention, referral to treatment and follow-up, and motivational interviewing. And not all of these will be applicable, particularly if the child's CRAFT score is 0 or they're not using substances and you're providing positive reinforcement. So I'm quickly going to go over the various components on the checklist, and I'm just going to read the bolded part. And this is a lot of information on these slides, and it's to serve as a resource for you if you're trying to understand a little better what each of the components is about. And then after I go through these, we're going to do a little bit of a fun role play here. So under the screening component of the checklist, there's 3 bullets or 3 components, and they are to accurately assess the quantity and frequency of alcohol and drug use, to accurately identify the adolescent's level of risk related to their use using an evidence-based screening instrument. So you all are using the CRAFT, so you're going to be able to check present on that one. And to assess possible consequences of the patient, client's behavior, such as physical, psychosocial, and other consequences. And then there's 4 components under brief intervention. Again, they may not all be applicable, so when you do the self-assessment or observe someone doing it, you're going to be marking either present, not present, or not applicable. They are that you've asked permission to provide feedback about the teen's substance use. You use reflection or open-ended questions to allow the patient-client to react to the screening results. You provide feedback about risks associated with substance use behavior, and you negotiate a goal with the client based on steps they are willing to take. This next section, referral to treatment and follow-up, that's if you deem the treatment and follow-up are indicated. And there's 3 components here. The checklist is looking to see, did you recognize the teen's need for substance use treatment based on their screening score and or other factors that you find out from discussion with the teen? The next one, suggested the use of specific community and specialty resources, and this can include a referral to the school-based health center behavioral health provider. And lastly, you're arranging appropriate follow-up if indicated. And then the last part of the checklist is looking at the motivational interviewing spirit. Did you summarize the patient's stated reasons for change? Did you negotiate a treatment plan in a collaborative manner? And did you affirm the patient's strengths, ideas, and or successes? So this slide shows you the back of the checklist, or the second page of the checklist. And it's some questions to complete if you do this as a self-assessment. It serves only to help you think through your interaction after the visit. So, what are we hoping everybody can do? This slide outlines the plan for assessing Fidelity. So again, we're asking all school-based health center staff that are implementing SBIRT to complete 4 of these practice checklists prior to your agency's annual SBIRT booster training with peer assistance. For some of you, that's coming right up. The checklist can be completed either through a self-assessment, so you do it yourself after you have a visit with a student or later in the day when you have a little time, or direct observation by a peer in the school-based health center. If it's done by self-assessment, be sure to complete the self-assessment part on the back of the checklist. And we're hoping at least 2 of the 4 checklists should be completed when there's a positive crack screen and brief intervention is therefore indicated. So let's practice. Kevin and Mandy will be role-playing the following scenario. And then after they role-play, Kevin is going to do a self-assessment, and he's going to ask you for your input on how he did with this. So follow along on the checklist and make notes as Kevin is doing all the things he's supposed to be doing, and if he misses anything. Let me read the scenario. Kevin is a primary care provider at a school-based health center. He's meeting with Mandy for a routine well child visit at the beginning of the school year. Probably many of you have been doing this today already. Mandy's 16, she's in the 11th grade, and she completed the Just Health app before her visit. And her GAD-7 indicated she has some moderate anxiety. Her PHQ was negative. On the craft pre-screener, she indicated she's drinking alcohol about 10 days in the last 12 months, and used marijuana 20 days in the last 12 months. And she answered yes to the relax and trouble questions on the craft. In the future goals section of the Just Health, Mandy indicated she wants to pursue a career in photography and move to New York City after she graduates. So I'm gonna hand it off to Kevin and Mandy.
Yeah, we just want to double check that everyone can see us. I guess if you can see us, just type yes into the chat box.
Okay.
Thank you.
All right, hi Mandy, how are you doing today?
I'm fine.
How's school going for you?
It's okay. My classes seem okay. I have like a couple classes with some friends, so.
It's good, so you get to see your friends throughout the day?
Yeah, a little bit.
Great. Well, I wanted to ask you if it would be all right if we went over the answers to the drug and alcohol questions that you answer today?
I guess so.
Okay. So you mentioned that you drank alcohol on about 10 days in the last year and used marijuana on about 20 days. Does that sound about right?
Yeah, that's what I said.
Okay. You also mentioned that you have used alcohol or drugs to relax, feel better about yourself, or fit in. And you also mentioned that you've gotten into trouble while using alcohol or drugs. Can you tell me a little bit more about the trouble piece?
Yeah, I mean, I was just smoking in my backyard with my friends, and my mom just kind of heard us outside. So she came out and kind of freaked out a little bit. So.
What were your consequences from that?
Well, she made everyone leave, which was super embarrassing, and then I was just grounded for like 2 weeks.
So you got grounded and had to kick all your friends out of your house at the time?
Yeah, it was the worst.
And what about where you marked that you've used alcohol or drugs to relax, feel better about yourself, or fit in? Can you tell me a little bit more about that?
Well, it was just to relax. I mean, the alcohol, like, I don't know, it was summer, we just drank a little, but I don't know, smoking just kind of chills me out, so that's really the only reason.
Kind of helps you
I
relax.
like it, yeah.
Okay. Do you feel like you're going through a lot of stress right now?
Yeah, I mean, my house, like, home is just kind of high stress sometimes. Like, my mom just gets kind of stressed out about stuff and then makes me stressed out, and then, I don't know, smoking is just a way to relax, really.
So you feel like your mom is kind of stressed out, and that in turn makes you feel a little bit stressed out, and the marijuana helps you deal with that a little bit?
Yeah, it's just like high anxiety, I feel like, at home a little bit.
Feel like you're dealing with some anxiety?
Yeah.
Okay. Well, I wanted to show you on this questionnaire that you filled out here. So 2 of the questions that you answered were positive or yes answers. And so if we look at this graph on the back here, having answered 2 of the questions as yes, that puts you at a 64% chance of developing what's called a substance use disorder, which essentially could mean that later on in life you might become almost dependent on using the marijuana and alcohol, or might make it difficult for you to go throughout your day without, using marijuana or alcohol. As your healthcare professional, it's my job to make sure you're doing everything to be as healthy as possible. And so I do want to let you know that it's my recommendation that you not use any substances until you turn at least age 21. There's a few different things that could be playing a negative role in your life with. One of them being, that it can harm your developing brain as you're still sort of learning everything and your brain is still kind of developing and becoming an adult. It can really put a hamper or sort of make it difficult for your brain to develop naturally the way that it should be. In addition, it can interfere with your learning and memory, and it also might put you in some situations that might be embarrassing or even a little bit dangerous. So I'm curious what you think about this information that I've given you.
I mean, I don't know. I know that stuff probably isn't great, but like, how are you supposed to like relax? It's just like so stressful at home. I just like don't even know
Sure.
what else to do really.
Well, let's think about this. If we were to look at a scale of 0 to 10, where 0 is you're not ready to change at all, and 10 is you're extremely ready, where would you say you put yourself when it comes to making a change in your substance use?
Maybe like a 5, I guess.
5?
Yeah.
And why would you say a 5 and not a lower number like a 1 or a 2?
I don't know. I guess, I mean, I definitely feel like kind of sluggish after I smoke. So I feel like with school, like, I don't know. I know I shouldn't be like smoking during the day, like just kind of crazy, but I don't know. I guess it wouldn't be bad to cut back now that school's starting.
Okay.
But.
So now that school's starting, you think it might be a good idea to cut back so that you're alert and you're paying attention in class and you're getting the most out of school?
Yeah, I mean, I do like want to be able to get into college and stuff eventually, so I don't know. I probably shouldn't be like out of it when I'm at school at least, so.
Sure, college is pretty important.
Yeah.
So I'm curious, if we were to see about cutting back on how much you're using, what steps might you take to make that happen?
I mean, I guess I just need to kind of like stay busy, I don't know, like just focused on, like photo was like pretty big in my life. So I think, you know, I should just stay focused on kind of what I want to be doing and not just kind of chilling after school, because I feel like that's usually when I was supposed to, I'm just like home and like chilling.
So maybe focusing on some of your hobbies, like photography, like you just mentioned?
Yeah, yeah. That shouldn't be too hard. It's what I like to do, so.
Good. Well, I think that's a great idea. You mind if I check in with you in a couple weeks and see how you're doing on your plan to cut back by focusing on hobbies like photography?
I guess so, yeah.
Okay, great. Well, you also mentioned the anxiety, so I'd like you to talk with our behavioral health person here at the school, so I will send you a referral over to speak with her, okay?
Is that like rehab?
No, it's just somebody to talk to. Sometimes it can help unload and you know, get some of your feelings off your chest, might help to relieve some of that anxiety.
Okay.
Okay?
Okay.
All right, great. Well, thank you for having this conversation with me today.
Yeah. Have a nice day.
Thanks, you too.
All right, so now we're just gonna kind of go through some questions to kind of reflect on the role play, and how Kevin did. So, let's see. So referencing the SBIRT Proficiency checklist that you all should have a copy of, we just want to know what you think Kevin did well throughout that, kind of like that SBIRT process. So go ahead and type your answer into the chat box.
Or you can also unmute yourself and tell me what I did right or tell me what I did wrong.
Yeah. Again, if you just take a peek at your checklist, there should be some just like different points you can kind of pull out.
So we have a comment that says asking permission to talk about various things and offer advice.
Okay.
So I have another comment that says summarize the visit well. Another comment that says, I liked how he worked on alternatives to substance use and how he was going to refer to behavioral health.
Okay.
One more comment that says time and permission for referral.
Okay.
One more comment that says ask permission for a follow-up in 2 weeks.
Okay. Okay, yeah, so just a note, so if you were doing this, that if you had the checklist in front of you or were doing it as a self-assessment, you could go through and kind of check those different boxes that you just mentioned.
One more comment, a couple more comments actually. One of them says affirmed the patient or client's strengths, ideas, and or successes. Another comment says he did a lot right, got screening, brief intervention, and referral, but didn't talk about specific community resources. Another comment says non-judgmental stance, focused on supporting healthy choices by providing info and offering behavioral health support.
Okay. All right, great. Good job, Kevin. So referencing the checklist again, what, if any, steps did Kevin miss?
Initiate a treatment plan, just follow it all. It could have been more historical. This is where
And again, feel free to unmute yourself if it's easier to just kind of comment out loud.
I think a lot of them don't. You know, yeah, this is, I think you do it. This is very,
Give you all another moment.
Comment says, I believe he hit on all of the questions.
I'm gonna actually hand it over to Kevin. Kevin, do you think you missed any steps, or is there an area you could have touched on a little bit?
Well, looking at the proficiency checklist and thinking back to my conversation, I didn't ask permission to provide feedback about the patient's substance use. And then there towards the end, I just sort of said, you're gonna go see the behavioral health person instead of asking the patient what they thought about that.
I feel like that triggered a little bit of a fearful remark from myself or the student. So it's kind of why it's important to provide autonomy before referring to treatment, for sure.
But don't you do that, you just say it.
And I'll add one comment too, that I think Mandy, as the student, acknowledged that she was using marijuana to relax because of anxiety at home, and very specifically said that was a coping mechanism. So it could have tied that back to the behavioral health person, as this person can not only be somebody that you can talk to, but can also give you different skills, coping skills, to deal with that anxiety that you're having at home, and it might have brought it back to what you had said. Yeah.
So this question is kind of very similar to the last one, but does anyone have any thoughts about how Kevin could improve his SBIRT process?
I don't think they're saying the questions. You have to do the screen.
Yeah, so I think they're just very similar to the last question. So just making sure you ask permission before referring to treatment or providing some of the resources. All right, does anyone have any questions, comments, or concerns about using the proficiency checklist in practice up to this point? So that can really be anything that's on your mind at the moment about collecting those 4 checklists, either the self-assessment or direct observation. Is there any part of the checklist that seems confusing to you? And that can include the back portion with the self-assessment piece. Feel free to unmute or type into the chat box.
You have one comment from the last question as well that mentioned how I asked a few closed-ended questions. For example, are you feeling a lot of stress?
Oh, yeah, good point. Yeah, definitely important to ask those open-ended questions so you can get, more out of them during the conversation.
The question is, are the 4 questionnaires per provider or per practice overall?
That's per provider. And bring the completed checklist to the peer assistance booster session, because there'll be some discussion about them at that time.
Yeah. All right. So what, if anything, do you anticipate to be challenging about using the checklist, and what do you anticipate to be beneficial? Or what could you see being helpful?
I don't want to raise the record.
All right, well, if anything comes up, definitely feel free to reach out, and we'll be happy to address any of the challenges.
I will add, Mandy, that when they did the validation study, they found the satisfaction of the preceptors who were precepting the medical student or medical residents using the checklist was very high. So we will be very curious to hear from you when you use the checklist, if you find it satisfying, helpful, or not.
Yeah.
And we'll share that with the developers.
And so you're reflecting back, did I actually?
Also have a couple of comments here, folks who might, who have identified some challenges. One of them says that some providers, like their RN, may not be doing the full conversations. And the other one says that I think that peer completion would be great feedback. However, I also think that having 2 adults in the room might make it uncomfortable for the patient. And then another one says, and some clinics have very small staff.
Well, I'll start by responding to that. We sort of anticipated that most of you will probably want to do it as a self-assessment because of that issue of having 2 adults in the room. And when we asked for feedback on the fidelity or assessing fidelity, we heard that. So it's just fine to do a self-assessment. I think the second question was, or the first question was about if the RN is doing part of it, but not the whole thing. I guess I would say if the RN is administering the survey, but not going over the questions or not assessing the risk, then the RN would not have to do the checklist. But if the RN is engaging in some of the conversation and reviewing the results, then I would say complete as much of the checklist as relevant to what the RN is doing.
We have one more question about clarification as to how many questionnaires per provider.
So it's 4 checklists per provider, and we want to see that at least 2 of the 4 checklists are done after a visit with a student who scored positive on the craft. And if you're doing it as a self-assessment, don't forget to fill out the back or the second page of the checklist, because there's some really good questions there to help you think through the interaction. And I know some of you have a training coming up very soon. Just do as best you can with completing the checklist, those 4 checklists before that training in a few weeks.
Yeah. Yeah, and you'll all also have access to these slides if you need a reminder about how many to complete. I'm also going to be sending out the link to this LCS, and in that email, I can also just kind of put those requirements in there just so that you have them in a couple places. Anything else? Okay, so this we kind of already mentioned, but so with these checklists during the booster trainings that will be scheduled with each site in the upcoming months, we just want staff to be prepared to discuss their experience using the checklist, you know, what the challenges were and what they found beneficial. And in those boosters, staff will continue to practice using the checklist through peer observations and role play. So even after you collect these next 4, it really doesn't stop there. We're going to continue practicing and kind of expanding on it as a tool to promote best practice. And then just a couple of reminders. These are kind of just overall reminders. So peer assistance services, we're currently reviewing the results of the project participant training questionnaire that everyone filled out. And so based on those results, we're going to choose 5 more learning community session topics. And those will be scheduled probably at the same time. The lunch hour was the most popular choice to kind of schedule these webinars. So we'll be scheduling 5 more of those, and per your contract, you are required to attend at least 2 more. This one counts as your first attendance. We will also be reaching out to schedule boosters with each site. Again, we'll be revisiting the checklist during those boosters. And then just a reminder that if you ever need to submit a TA request or technical assistance, you can use this link down here, it's hyperlinked, to fill out a TA request form. So that way we can get your information and reach out as necessary.
And just to clarify, the technical assistance that peer assistance is offering is one thing you could ask for is if you're just having trouble doing a brief intervention and figuring out what to say and how to do it, they are here ready to help you with that. So I think it's a great opportunity.
And we'd be happy to do that via email, phone call, Zoom, whatever is convenient. So.
Okay, so we just have a little time for any last minute questions that you have. These can be about the checklist, about the learning community sessions, booster training. Feel free to unmute and ask those questions or type them into the chat box.
We have a question, one last time, where do we obtain the checklist from? I can send it to you in an email. If you would just leave your email address in the group chat there, maybe we'll just do one final swoop at the end of this and resend it to everyone.
Yeah, and when I send out the link to the LCS, I can also put the checklist in there as well, so. All right. Well, if you do have any remaining questions, so say you have questions about your contract requirements or, LCS attendance, you can feel free to reach out to Christina Green. Her email's listed right there. She's the SBIRT School-Based Health Center project coordinator at CDPHE. And then if you have any questions regarding SBIRT trainings and TA, you can feel free to contact me with peer assistance services, and my email is listed up there as well. All right, so we're going to take a minute to complete the survey. I believe it is linked in your PDF slides. I think we're also going to send it in the chat box now. It's a SurveyMonkey survey. It's very brief, so please just take a minute to fill that out. And again, if you have not yet typed your name, job title, and email address into the chat box, take a moment to do that as well, just so that we can mark you as having attended this session. All right, so go ahead and complete that survey. After you're done the survey, feel free to exit this session.
Oh, yeah.
Survey, you get 10 questions, and that's it.
Oh.
I mean, for the internet world, you can see that competition and how they're just leading away, which. Sorry, it's gonna take me a minute to type in everybody's